So I believe at this time of the day, it's actually a good afternoon, everyone. Lena has introduced us, so without further ado, I'll just let you know that today, as a first for Sydney Local Health District and for our Public Health Unit, we'll be showcasing our new innovative web-based application that we call FluCare. And we've really designed FluCare to help support nursing home staff reduce that health impact of flu outbreaks for elderly residents in aged care. And just an outline of what we'll be talking about today. I think it's important that we demonstrate to you why do we need this application. I think then we'll talk a little bit about really what the purpose of the application is, but really more importantly, why is it innovative? Why is it new? Why is it interesting? Travers will helpfully showcase its functionality. And then I'll talk a little bit more about our comprehensive plan for our research and evaluation. And that's important because if we're going to have something new and innovative, we want to test and know that it works. And then I'll talk to you a little bit more about what's going to be in the future. So how and when and where will we use it? How will we test it? And what are the next steps? And I think it's important at this point to say that we work with a really large team on all of our projects that we do. We work in a partnership and multidisciplinary way. We have a large working group, a great group of people in our public health unit, and I hope some of them are here today. And in particular, I just want to acknowledge FAQ, our digital developers, who have been with us for a long journey for the development of this application, and we're really excited to be piloting it this year. And of course, the pitch funding that we won 2 years ago, which was really the genesis of this app. And our ICT team in the district too deserve a shout out because they've really come on board, dedicated resources and time to help us develop this app. Well, why do we need FluCare? Well, it's probably not new to most people in the room that every year influenza or flu causes over 100,000 cases of disease, over 2,000 hospitalisations and 400 deaths annually. And we know that nursing home residents in aged care facilities are very vulnerable. They're actually at the greatest risk of hospitalisation and death due to flu than any other age group. Another point to make is that health economic studies have shown that flu costs our healthcare system over $120 million annually. And we know that nursing home staff in these facilities, the people on the ground that have to manage these outbreaks and look after the elderly patients, actually have quite a significant workload burden. And that's in terms of the reporting that they need to do with us, but that's also due to those early outbreak measures that they need to implement to reduce that spread. We've also done some research in our unit that's shown that, unfortunately, sometimes we're notified of the outbreak a little bit later than expected. And that's a problem because there's really good evidence to show in the scientific literature that if we can detect these outbreaks earlier, we can implement a really rapid response. And that's really critical because that reduces hospitalisation and deaths for those elderly residents. And the last point to make, which is around that innovation and what we want to do in this area, is that there's evidence to show that these web-based applications have worked in supporting outbreak detection and response in countries overseas, but really there's a lack of research in the context of the Australian healthcare system. And we believe that aged care is actually an underutilised setting for public health research. So what is FluCare? You're probably very excited to know. Well, FluCare, or the Influenza Outbreak Communication Advice and Reporting app, is to assist really those nursing home staff in the early detection, that notification process, and then that response. And it does it by providing a streamlined web-based system for that data collection, but it also has the functionality to automatically detect and then notify the right people at the right time when we have an outbreak. And as I said, that's really important because that can help us implement that rapid response. So why is FluCare innovative? Well, we believe it's the first of its kind in Australia. And I say that because there are web-based applications that really do look at early detection and surveillance of outbreaks and flu. But there's not a lot of applications, or any, that really focus on response and providing resources and tools in a really easy, accessible way for people on the ground to manage those outbreaks. We've also had a great partnership with FAQ, our third-party developers, and it's really great to see the healthcare system party with a private provider. The application itself can be easily scaled up across 100 or more, really, aged care facilities. And we also believe that FluCare is transferable. We believe that we could use this in other settings like childcare, and certainly for another high-burden disease like gastroenteritis. So I'll just hand over now to Travers, who will showcase the app.
So this is the entry portal to FluCare. So this is where users will come in order to log on to the application. And there are two main user groups. So there's public health users, so that's us in the public health unit, and then there are aged care users. So they're aged care nurses, managers that work in the community with residents. If a facility doesn't already have an account, they can also come to this web page. They can click register and they can go through that process to lodge an application to use the FluCare application. And the public health unit can then review and approve that if they're a facility in our district. Just to point out, the logo is currently under trademark review, and this will form a real key part of our advertising and branding going forward. So once logged on, this is what the public health unit sees. So this is the public health unit's dashboard. And you can see across the top of the screen there's a couple of things I want to point out. So firstly, there's the overview of the summary statistics. So that just gives an indication at a glance what's been going on in the district. So we can see there, for example, and this is all testing data, just so you know, there's 13 active outbreaks this week. So in reality, the public health unit wouldn't be here right now, would be back in the office because this would just be a nightmare. Underneath that, we can see all the current situations. So again, there's 14 of those at the moment. So this is any aged care facility that has entered any information onto FluCare to indicate that they've got a current situation at some level, and I'll go into those in a bit more detail. So the primary users for FluCare will be aged care facilities, so we'll look at what their dashboard is. So we can go into that and we can see what aged care facilities see when they're using the application. So in general, it's got the same look and feel as the public health unit dashboard, but there's some key differences. So firstly, I'll just point out along the top of the screen, or the top of the page, sorry, there's that grey bar, single ILI, so meaning single influenza-like illness, and that just gives the facility at a glance situation awareness of what's happening in their facility according to the residents they've entered. Underneath that, we can see the residents with symptoms. So that's effectively the line list that the facility will use to input resident information, tick off any symptoms that they might have, and they can also add progress notes in other parts, which I'll show in a moment. So you can see that first resident there, Mickey Mouse, he's got some symptoms, and FluCare's detected that according to these symptoms, he's meeting the criteria for influenza-like illness, so he's been flagged in that orange colour. If we have additional progress notes that we want to add, if a doctor has reviewed or if we have laboratory results, we can do that through the progress tab. And here we can just, from a drop-down menu, select what lab results we have. So we can have flu A, for example, for Mickey Mouse. Scrolling to the bottom of the page, the facility can confirm the line list, and it's at this point that all the information gets saved onto the FluCare database and becomes accessible by the public health unit to begin reviewing. At the same time as this, FluCare's algorithm is automatically interpreting this new information to determine whether or not this needs to affect the situation. So as soon as they hit confirm, they get a real-time response, a pop-up alert telling them exactly what's changed in the facility. So now we have a single influenza, and there's some actions that are provided there just to begin implementing some control strategies. Back on the aged care facility dashboard, you can see that that top situation bar has changed from single ILI to now read single influenza. And that top resident has also gone from that orange colour to a red colour, indicating that they're the one that has confirmed influenza. In total, there are about 11 different situations on the pathway towards an outbreak. And just for time's sake, we're not going to go through all of them, but we'll continue to progress this one. So we can enter in some more symptomology for the other residents, additional progress notes, so we can enter in if we had any negative flu results, that would be other, some more flu A's, flu B, sorry, and a flu A and B. So they're the different options we can choose for respiratory virus results. And like before, they can scroll to the bottom, they click confirm, and FluCare will automatically interpret that new information and determine what's changed. So now it's saying that a confirmed outbreak has been detected. At this point, FluCare's automatically emailed the public health unit. So if we're not already on FluCare looking at what's going on, we've got an email come through to our inbox saying you need to log on and you need to review the situation. And it's also asking the facility to look at the action checklist. Back on the facility's dashboard, you can see the residents with symptoms has dropped down to the bottom. They can continue to update that as needed, but really the primary function now is working through all these checklist actions that they need to do in order to control the outbreak. As they do these, they can tick them off, and this means that when someone else logs on to that dashboard later on during the day, they don't repeat any actions that have already been accomplished. They can just go on to what's needed to be done. They can click on the little arrow to get additional information if they need more detail as what's required for that particular action. And there's also resources that we've loaded onto FluCare. So there's a range of resources that they have access to that can be used to help control an outbreak. So these are just some posters, for example, that can be downloaded to just help inform residents and visitors of what the situation is in the facility. There's also fact sheets that can be downloaded and printed off. And these are all currently already available on New South Wales Health website. Some of those are from the ACI. And it just really puts them all in the one spot to save time during an outbreak. Obviously, they have all their other work that needs to be done. And this just reduces them having to search around for them and to find them. They're all right there, immediately accessible during the outbreak, right from FluCare. Continuing down the list, one of the other important actions is to contact the GPs of residents during the outbreak. So it's important that a GP can review their patients. They may need to prescribe antiviral medication, and this can take time, particularly if it's getting close to 5 o'clock on a Friday. And so FluCare can also handle this process for the facility and for the GP. So at the same time as clicking confirm line list, at the same time that the public health unit gets those email notifications, any GPs that are registered with FluCare will also receive an email notification prompting them that a situation's been detected in a particular facility and that they need to plan out how they're going to respond to that. This is just an example of some of the emails that get sent from FluCare. So we can see here this top one, a high priority alert has been detected, and there's some actions that the public health unit needs to do. Just two more things I'll just point out. So the information flow on FluCare is two ways. So facilities can upload information or their resident details, but they can also download that information. So they can click on that green button to export a daily report, and that'll just automatically download an Excel line list that contains all the information that they've already updated, so all their resident details, all the symptom information, and any progress notes that have been attached, and they can then use that for their own historic reporting requirements or for any internal requirements that they might have. Likewise, the public health unit has access to a range of reporting features as well, from individual line lists through to full outbreak situations. So we can see here all the different situations on that line list we're just looking at as they progress in real time. So we can see the date, the time, the situation category, and who triggered that situation. All this information and this data feeds back into part of our research and evaluation plan, which Emma's just going to finish up on.
So thank you, Travis. What a great showcase. And we're piloting our app this year during this flu season, which is very timely. So how will we know it works, right? So we need to have a comprehensive evaluation plan and protocol. And we've got a two-phase approach. So in the first year, we'll be looking at a pilot evaluation, and that's really what we call a feasibility pilot. So during this stage, we'll be looking to test with the nursing home staff whether the application actually works, whether it's useful and user-friendly, and we'll also be starting to look at some of those factors that might help us scale up into a further effectiveness study. We're also interested in knowing, does it actually contribute to reducing that workload burden in terms of that data collection and reporting? And then following that, we're also be looking for research grants to help us with the effectiveness study. And this will need to be quite a large study, given the burden of flu and outbreaks. But really, at this point, we're looking at, does it actually meet its aims, and does it reduce those health impacts for those elderly residents in nursing homes? So some of the key outcomes we'll be measuring is that reduced time to notification, because there's really good evidence to show that if we can reduce that time that we get notified, and the nursing home staff implement those response actions, we can reduce the outbreak duration and we can reduce hospitalisations and deaths. And lastly, but not leastly, what's next for us? So as I said, we're really excited. We're piloting the application this year with around 25 to 30 nursing homes across our whole district. All of the local councils are involved. We'll be employing a senior research officer as part of the research grant funding that we'll have. That'll help us lead the study under our team with Lena, myself and Travers. We're going to develop some webcasting videos to try and help with the educational side of things. We'll also be testing out our evaluation instruments and obviously comprehensively reporting on our findings. And two last points just before I go. We also need to think big. This is a new area for us, and we're really in that innovative space of kind of technology and healthcare. So we really need to engage with other sectors, and government and non-government partners. But I think it's really important. We're all here today because we're focused on health equity, and so we really care about those elderly residents in nursing homes and reducing the health impacts of flu for those people. So that's our goal. Thank you.